need less sleep. Now, I don't know how you solve that problem. If you take a poll and ask older people, how many hours did you sleep last night, chances are they're going to be fewer than younger people. And that's not because they're older. That's because men have to get up to empty their bladder frequently during the night. Men and women have arthritis and have pain. They may have restless leg syndrome. So the aging process itself, in my opinion, does not result in the need for less sleep. Melatonin, which is the hormone that induces sleep and produced by the brain, has the same concentration in recent studies in younger people as in older people. So there's no physiologic reason. I think if older people get less sleep, it's not because they need less. It's because they are unable to sleep, and you find them dozing during the day. So if you go to your doctor and you say, listen, I'm not getting enough sleep, and he says, well, that's fine. That's because you're older. Don't buy that.
Okay. And you've also talked about naps, how important naps are, no matter what age you are.
That's right. Winston Churchill used to nap for half an hour every afternoon. He won the war.
You heard it here, folks.
Some very important news happened this week in the medical issues. That's for heart patients. And if you are one or you know someone and your doctor recommended the anti-clotting drug Plavix, there's some new developments in that. Doctor, what is it about Plavix?
This is very important. Plavix is a wonderful drug. It prevents clots from forming in your arteries. It does so by interfering with the action of cells in the blood called platelets, which have a tendency to clump together and form clots. So doctors prescribe Plavix in a wide variety of circumstances. After a heart attack, you're given Plavix. If you've had an angioplasty and a stent put in, you're given Plavix. And how long you are to continue Plavix depends on your doctor and his experience with it and why you're given it in the first place. So people take Plavix anywhere from a month to a year. Mostly, if you've had an angioplasty, it will be at least a year. If you've had one of these drug-eluting stents, the medicated stents, it may be forever. But at some point, the doctor will tell you, now you've had Plavix long enough, stop it. Here's the point. Don't stop it abruptly. There's been research that shows that people who've been on Plavix for some period of time and then just stop taking it have an increased 2 times the incidence of heart attacks and other vascular events. It doesn't happen very often, but it happens twice as often as if you were to discontinue the Plavix over a period of weeks. Very gradually. For the first little while, take one every other day, then one every third day. Taper it. And I suggest that while you do that, you start taking an aspirin a day. And as you stop the Plavix, you'll have some other clot prevention. But don't stop it abruptly.
Okay, Dr. Rosenfeld, thank you. You know, we try to get in as many viewer emails as we can, and Joni was wondering about the significance of aortic calcification.
The development of calcium in your body, in your aortic valve or in your blood vessels, is a very important sign. It often happens in people who have no symptoms. But if you have an echocardiogram and are told that your aortic valve is calcified, or you have a CT scan of the abdomen and you're told that your aorta has calcium in it, you should take that as a warning sign that you may be developing atherosclerosis and that you need to be watched. Very often, that is the first sign of vascular trouble. So if you are found to have aortic calcification, have your sugar checked, your cholesterol level, your blood pressure, all your other risk factors, see your doctor, have a stress test, and see whether the presence of this calcification already indicates some underlying disease. It's a significant finding.
And let's go to another email now. We have this one from Bob here in New York. Bob says that his mother is on an anticoagulant drug, and she's actually been told not to have green leafy vegetables like lettuce and broccoli, and what, doctor, even cranberries and beets? What's this all about?
Yeah, the anticoagulant drug he's talking about is warfarin, commonly called Coumadin, a brand name. This particular anticoagulant works against vitamin K. It reduces the activity of vitamin K, which induces clotting. Now, these vegetables contain vitamin K. So many people think that if they're on warfarin, they should not eat these vegetables because it has vitamin K. That is a myth. That's the myth I should have started with. Yeah.
Yes.
If you are on warfarin, it's perfectly okay for you to have all these leafy green vegetables. But here's the warning. Don't have lots of them for many days, then suddenly stop, because that disrupts the action of the warfarin. You can have these vegetables if you have a constant amount every day. Don't suddenly change whether it's too little or too much. And it's a good idea while you're on these vegetables, once you've started to eat these vegetables in a certain way, have your doctor check how effective the warfarin dosage is that you're taking. It may be that the doctor may have to raise it or lower it a little, but once you get that information, stay with that diet of vegetables. They're very good for you, and don't worry about the effect on the warfarin. It's negligible, or there's no effect at all.
Benefits. We know how healthy it is. Is that a problem?
No, it's not. Just the normal cooking of olive oil retains its benefit. It's a monounsaturated fatty acids. It's an important part of the Mediterranean diet that's associated with a very low incidence of vascular disease. It's part of a healthy diet. When you cook, when you heat the olive oil, it may lose some of its alcohol and some of its other constituents, the esters in it, and it may change the taste. But normal home cooking. Now, commercial frying, repeated frying at very high temperatures does affect it.
And all these electronic gadgets. But sometimes you wonder, how are they impacting our bodies and our health, especially for men? What should we watch out for?
You know, it's a funny thing about cell phones. Every day you hear something different about a cell phone. You know, you hear that if you use it too much, you're going to get a brain tumor, you get an acoustic neuroma, you get this, you get that. Now they've gone south. And they say that if you use a cell phone more than 4 hours a day, then the quality of your sperm is reduced, the count is reduced, the mobility is reduced, and may affect fertility. I quite frankly don't buy it. They say that if men who keep their cell phones in their pocket, I don't know how you can have a conversation with a cell phone in your pocket, but in any event, if you keep the cell phone in your pocket for a long time, it will affect sperm motility. I think this all started a few years ago when they tested rats with the electromagnetic energy from cell phones and found that it did affect their sperm quality. So what do we do with this information? Nobody who's listening now is going to stop using his cell phone because of this report. But I think that if you're having a fertility problem, if you're a man with a fertility problem and there's some problem with the motility or number of your sperm, then don't keep the cell phone in your pocket, and perhaps use the landline more often. But this is not a news item that I diagnosis is made. You shouldn't panic. Just get checked every so often by your urologist for a PSA test, a physical exam, and so on. Now, I have to tell you one thing. A large part of this is psychological. I know that if they were to find such a cancer on me, and I'm over 75, I probably would not leave it alone. I think it takes a certain kind of personality to live with the knowledge that you have a slow-growing cancer. But if you are not neurotic like I am, and you're found to have this early cancer, it's apparently safe to watchful waiting as long as you're checked at frequent intervals. And a much lower incidence of serious macular degeneration. So my message here is not so much about macular degeneration as it is about eggs. Eggs are good for you. Forget the old stuff that we used to say on broadcasts like this, that you shouldn't eat a chair without doing it. Just as I can't get off the chair without doing it
You did
today.
it twice now. You don't have to go to the gym. What a great tip. That's really great. You won't have to have those chairs that bounce you up.
Very important, actually.
Thank you, Doctor.
Good point. Thanks, Doc. Good to see you as always.
We'll start tomorrow. Take care.